Like for some students we offer for less fees, for some students we offer for more fees. It has never happened. The only exception is that we have provided the scholarships for many of the developing countries. You can go to scholarship.windsor.edu and see the number of countries we give scholarships to. For example, Haiti. Haiti qualifies for scholarships. We have given so many scholarships for students from Haiti. Even before the earthquake, we always consider that the healthcare is needed in these countries. And for example, take Niger, or Nigeria, or any other developing country. There are only 3 physicians for 100,000 population.
Right.
We don't charge any tuition fees for that. There are many students we have given scholarships. Windsor is just not here to make money or just not to develop economically, but it is also important that we look at the healthcare situations in the different parts of the world and make a change.
That's great. Does Windsor charge any hidden tuition fees outside of the originally advertised tuition fees?
You know, this question has been raised. People write on forums, I believe, on these. You know, the tuition fees has always remained the same. When in 1998, when the tuition fees, the school provides a one flat tuition fee where all your dormitories, your textbooks, your USMLE review course, your transportation, your cafeteria is included. The only reason for that, Venu, is students, when they come and if they can't afford for the transportation to go from the dormitory to the school, landlords don't give apartments to them because students destroy the apartment, so we have to sign the guarantees, and then they have to put up hefty deposits, $10,000, $20,000. Students and parents don't have money during this time. So the Windsor included the dormitories in the tuition fees. That is one of the reasons. And we didn't want students to go and take the housing wherever they want, because there are many bad areas, there are many good areas. Just like any other city, we want to make sure that the student is safe. So that's the reason we have included the dormitories in the tuition fees. And in 1998, one bedroom apartment used to cost $250 per month. At that time, all the dormitories were included. We didn't change that. We still included the dormitories. But at the current time, a one bedroom apartment in St. Kitts costs $800. But the tuition fees never changed. But the housing has gone up. So what we said was, at that time we were able to give you one bedroom per student. We can't. US dormitories, many schools in US dorms. Have you seen a dorm in Temple University in Philadelphia? You should see there are 2 beds in a small room. But Windsor used to give 1 room per person there. And the times have changed. It's gone from $250 to $800 per apartment. We started putting 2 beds in 1 room, so that still can be affordable. But many students want to have their own room. So we have given an option. If you want to be included in the dormitory, you can stay in 1 room, sharing the bed, sharing the room. Sorry, but if you don't want that, you want a single room, then you have to pay a surcharge and take it. I can't do anything. As the inflation goes up, the landlords charge more.
Right.
But we have never changed the tuition fees. So the dormitories are still included. If they want a single room by themselves, they are paying a surcharge. So there's no hidden fee. When they come there, they say we have to pay a surcharge for the dormitory. No, we are not asking for a surcharge if you share a room. We are asking a surcharge only if you want an independent room by itself. And also there are many good areas and there are many expensive areas that students want to live. Of course, the amount of rent would be more, just like any other city. Take in Chicago. If you live in downtown, it's very expensive. If you live in a suburb, it's less expensive. But all students want to live in downtown.
Right.
So for anybody who wants those additional facilities, they have to pay the surcharge. But people think that Windsor is charging surcharge as a hidden fee. It's not a hidden fee. And also people think that there are hidden fees like, is there any lab fee? We don't include any lab fee. Is there any USMLE review fee? We don't include any USMLE review fee. But there is a hurricane fee. Hurricanes do come in Caribbean islands, as you know. It is our responsibility to move it's like an insurance. We have to make sure that the students get all their facilities when the hurricane comes. We have to move them to shelter homes. We have to put them in a strong, good hotel. We have to ship them out. And the Government of St. Kitts want us to, there are regulations that we have to take care of that. And we have to prove to the government that we have that. School cannot do that. So that is the reason we ask for a $200 every 6 months as a hurricane fee. That's just like any other insurance. We pay car insurance, right?
Right.
So those are type of minimal fees. Now there is another fee, activity fee. Many schools charge student government fee. We don't even charge that. What this activity fee does is for their own, or for their own farewell party, for their own white coat ceremonies. We don't use that. It's being used for its own purposes. The only fee that Windsor University collects is the tuition fee, which is the most affordable tuition fee, which I believe is the one that's been charged.
Okay. Is Windsor charging any fees towards community service projects that apparently do not exist?
Well, Venu, as I said, the forums, the online newspapers, the disgruntled students who go out and speak, making false statements and all, the record should speak for itself. I want you to go look at what we have done. When we say what, it's not the school. It is our students. I am proud to tell you that Windsor University students, Windsor University faculty, Windsor University's administration have done an exceptional job. We have adopted 2,400 villages in a remote South India where there is absolutely no health care. A woman giving birth to a baby in a village, they don't have any nurse, even, or a midwife to conduct the delivery. People have incidents of cerebrovascular accidents has gone up because of the hypertension. Diabetes has gone up because of increased carbohydrate intake. So we have done a lot of work. We have collected the data. We have given it to the students. Thousands of patients. We could never have seen all these thousands of patients without the help of Windsor University students. The students have contributed to this. It's called a community medicine program. Dr. Brijinder Gupta, who was the professor of microbiology. He comes from a prestigious college in India, Dayanand Medical College, and he's also right now, who migrated to Alberta, Canada, has been with us for the last 8-9 years as a microbiologist. The program is done under him. It's a Project 2400. Anytime, anybody wants to challenge this, they can ask for the data what we have done. We have seen thousands of patients. I'm going to show it to you, the pictures, the students, what have contributed, how the physicians have seen. The students have bought a van, and we have the whole staff there, a nurse, a medical technologist, a physician, going around village to village, where people were never thought this would be given. Windsor University is proud to do that. So we will never say for what we have not done. It is false that we have not charged anything. We have not charged anything except the Project 2400 that the students have contributed. It has gone to the remote villages to take care of the healthcare needs. The data is there. The patients are there. You can go and talk to the patients. You can go and talk to the physicians who have doing the service. I am proud that Windsor University students have done that. And we are giving a certification to the students also for having been participated in Project 2400.
Excellent. What about the fees towards books and retake examinations?
Well, this has been a common complaint, and students are unhappy with the additional fees towards the retake or textbooks. In the current economic times, I have seen many students who go beg, borrow, and family contributions. We want to provide medical education for all sectors of society, I told you.
Mm-hmm.
Even if they can buy an airline ticket, even if they come up with the payment for the tuition fees, right? A lot of times they don't have money to spend for the textbooks. Textbooks are very expensive. American Airlines charges $50 addition for the baggage, just for their regular clothing. If you bring all the textbooks with reference books and all, which are so expensive, and they bring it in the suitcases, they have to pay the customs, they have to pay the baggage, they have to buy the textbooks. It's a difficult thing. especially these days when Terry loans are not there, Salome loans are not there.